All right, we're back, and this time I have with me Mary Craig from Ivy Tech Corporate College. She's going to talk about the healthcare changes that are taking place in our community right now and how that's going to change workforce skills. So welcome, Mary.
Thank you.
And how is the corporate college addressing employer needs with the changes in healthcare today?
Well, first of all, we are having a statewide healthcare summit titled Transforming Healthcare with a World-Class 21st Century Workforce. That will be on March the 14th from 8:30 to 4:30, and the doors open at 7:30. This will be at our central office headquarters, which is in Indianapolis, and that is 2820 North Meridian Street. And for those of you that are familiar with Indianapolis, it used to be the old Stouffer Hotel.
Okay.
We're going to hear from industry leaders about the challenges and opportunities of balancing delivery of high-quality health care and running a successful business.
Okay, so what is the focus then of the summit?
The summit is going to focus on how to reduce costs and improve the quality with a staff willing to engage in the changes and evolve with the industry as it moves forward. Our keynote speaker is David Metzler, and he comes from the University of Chicago. He will be kicking off the event, and he was a contributor to the Institute of Medicine report titled Best Care at a Lower Cost: The Path to Continuously Learning Healthcare in America. And he will also be discussing report findings and the evolving healthcare workforce. Following Dr. Metzler, there will be a panel of healthcare leaders from across Indiana and the outlying metro areas. They will be discussing the challenges in managing transformation and the bottom line. You know, it's always about the bottom line.
Sure. I'm all about the bottom line. My bottom line's really way down there too. I don't know if you. Well, enough about me. So, are you gonna have some breakout sessions in this thing, and what will the topics be?
Yes, some of the topics within the breakout sessions. There are new nurse support roles. So a lot of positions are going to be changing. Titles of positions will be changing. New positions. There's patient-centered medical home and community health worker. Community health worker is a new concept as well. Within the last, I'm gauging approximately 6 months, there was a new mandate that went into place. And hospitals that have seen an individual for a specific illness, once that individual is released, they cannot, if they had to readmit them within 30 days, right, they don't get paid.
Right.
So having that individual that serves as that liaison between the hospital and the patient, making sure that they're doing according to their discharge. Maybe it's making sure that they're taking their insulin or setting them up with the proper resources, kind of like our 211 does here. Right,
because as I understand the way that this is going to work is that the Medicare payments are going to come to the hospital that first treated the patient. Exactly. They have a certain amount of time under a protocol to release that patient then back into the community, and all they can do is then educate that patient on the way out the door what they need to do to prevent coming back to the hospital.
Absolutely.
But that's usually not enough to secure that full payment. So that's where this community health nursing steps in, is what it sounds like, right, is to keep a tab on that patient to make sure they're keeping up on their medications and their therapies and exactly, maintaining the proper healthy lifestyle so that that readmission doesn't take place and everyone gets paid and everyone's happy, right?
Absolutely.
Okay, well, I do understand it a little bit.
They don't want to see them back within that time frame. And this individual doesn't dispense medical advice. You know, they're not a nurse, but they keep them in touch with those resources that they would need.
even though they're a monitor of sorts, this isn't
Yes.
something that's going to be overbearing for the patient either, I wouldn't
Correct.
think.
Correct.
So it's supposed to be a seamless interface. Is that
Correct.
accurate?
I'm sure it will be different. We're not used to or accustomed to someone continually calling us and checking in with us after we've been discharged. But that is really, I would see that as a bonus, actually.
Sure.
So,
And it really would be up to the patient, the level of interaction that they have with that community health nurse, too.
absolutely, make sure that you drew in what you're supposed to do. Maybe they won't call you so often.
Sure, sure. So this is a really important summit, is what this sounds like.
Absolutely.
So how do I obtain more information or register to be a part of this event?
You can go to www.ivtech.edu/corporate-college. And if you will look in the left column, there will be a link that says Transforming Healthcare Summit, March 14th. And that it would be right above
right
Disney
there.
logo. Right there it is.
Mhm.
And that will take you to further information. You can get some real detailed information about breakout sessions and what you can expect that entire day. One of the other breakout sessions was ICD-10 and the cash flow impact. And the individual, Mike Hodson, that is going to provide that breakout session is from CareerStep. And that's somebody that we work with. They're a healthcare-centered training organization.
Tell me a little bit about this ICD-10. I'm not familiar with that.
Okay. ICD-10 is a coding. Right now, they're on the ICD-9, and there is a lot more codes in the ICD-10 than what there were in ICD-9. I'm guessing it's probably a little bit more than 2/3 more codes than ICD-9, but it allows them to detail a patient's care more succinctly than what they've ever been able to do
I see.
in the past.
Okay.
I was given an example that there may be 5 different ways to perform a specific procedure.
Okay.
Maybe it's a knee scope.
Okay.
There may be 4 or 5 different ways that they can process the scoping. And the ICD-10 actually breaks it down into, you used method A or B. And it will give the information, this patient was 18 to 25 years old, they're a diabetic or what have you. So there's a lot more specificity with the ICD-10 versus ICD-9. And I think that offers, down the road, you're going to be able to look at reports and say, well, for individuals that were 18 to 25 years of age, procedure C had the best outcome for them.
Right.
So there will be a lot of information that comes out of this that is going to be good
Sure.
in the long run, but in the short term,
it's going to be really more complex than it ever has been before for a healthcare provider, because perhaps this healthcare provider is comfortable with a certain procedure, and that may not be the prescribed procedure for every case. That's going to be a mountain for them to climb that they may not be used to. But as I understand, the flip side of that is if they do the proper procedure, you have a greater chance of getting the full reimbursement from Medicare on that procedure, and a lesser risk of a repeat or a return on that procedure, right?
don't want the return patients.
No, absolutely not. So, are you offering some training that's tailored to the employers that might need to reskill their workforce on meeting the new demands of this healthcare program?
Yes, we do, and that is Mike Hodson I was referring to before. They are really focusing on the ICD-10 implementation. The mandate is October the 1st of 2014.
Okay.
They go live.
Gotcha.
Originally it was 2013, and that was pushed forward. CareerStep offers this ICD-10 training, and they also offer some webinars
Okay.
that are open to the general public, so employers can attend this hour-long webinar, and it covers everything that they have available to the employer, where they can assess the employer's individuals prior to determine exactly what kind of training each individual needs. And from my understanding, because of the specificity now in the ICD-10 coding, that coding will take place at many different stages, where it's not just on the billing end anymore. From the time the individual walks into the doctor's office. So there will be possibly individuals coding that hadn't coded before. So, you know, that may lead into anatomy and pathophysiology training as well. So ICD-10, in conjunction with anything else that they may need, CareerStep does offer this training program, and they will tailor it specifically to any employer's needs.
Now, as I'm seeking my degree in the healthcare field, this sounds like a really important piece of information I need to have. Can I get college credit by going through CareerStep?
They do have, in some of these courses, they do have CEUs, which those are continuing education units.
Okay.
And through AHIMA, which is the American Health Information Management Association, or AAPC, which is the American Academy of Professional Coders. So some of these courses that CareerStep offers are CEU eligible. So
great. All right. Well, that's a lot of information we just laid out there. If I'm looking to get into the healthcare field, where can I get more information, or how do I get a hold of it, Ivy Tech, to find out what you're offering to get me toward that goal?
The best thing to do would be to call myself. I can be reached at 765-459-0561, extension 281, or you can send me an email, which is mcraig@ivytech.edu. And if you forget the extension, if you just call the main line and ask for Mary Craig or Corporate College, they'll always get you through to the right person.
Excellent.
Yes.
Very good.
Eventually.
All right, Mary, thanks so much for coming on the show today.
Thank you.
It was great to meet you.
You
We're going to go to break, and then we're going to bring back Outdoorsman Bud Fields.